About to talk about blood donations and challenges that the Red Cross is going through. Before we do, though, I'd like just to introduce you. Allie, do you mind just saying your name, your title, and just a little description of what you do?
Yeah, my name is Ali Barraza. I am a communications director for biomedical services of the American Red Cross. We work together with our field teams, our regional teams out in the field in Connecticut, and the other regions across the U.S. To really spread the message about the importance of blood donations. Our main mission at the Red Cross is to alleviate human suffering. Part of that has to do with making sure that hospital patients have access to the blood products that they need. So it is our great responsibility and just, our privilege to be able to speak about the importance of blood and how it helps save lives. And that's our mission.
Thank you, Allie. I mean, look, you are in a tough position right now. I mean, because blood donations is intimate, right? You have to be there. You're face to face with somebody. Usually, it's in groups. You're doing it. I know in a high traffic, foot traffic area. So, just talk to me about how have donations been affected since the social distancing orders have been put into place?
Yeah, so really since the beginning of March, we saw March into April, we saw a really sharp decline in not only a reduction in donors that were coming out to drives, but also sponsors who understandably were going ahead and canceling their blood drives. We host 80% of our blood drives within the community. That's your churches, your schools, your malls, your community organizations. So understandably, we, recognizing that times were changing, and in order to be as safe as possible, unfortunately, those blood drives had to cancel. We saw thousands, tens of thousands of blood donations go uncollected at the kind of the outset of the pandemic. And again, it is understandable. We had to adhere to social distancing. There were stay-at-home orders in place. So what we were able to help explain to donors and what happened, I'll follow the surge and give you a little example of what we saw after those first initial weeks, is explaining that blood donation is an essential service. We're talking about, essential workers heading into work and that sort of thing when the pandemic really started. And so when it comes to blood donation, that's an essential service. The Surgeon General had come out and said that is an essential service. And really that is something that we wanted to get the point across to our donors, that the need for blood doesn't stop no matter the situation. And we are doing everything we can to make sure that donors, our volunteers, our staff feel as safe as possible during this process. We've enacted several different new safety protocol measures at our blood drives, whether it's in the community or at our blood drive centers, to make sure that people feel safe and that is a positive experience for all that come out to donate.
And so maybe you could talk about that. What are some of the precautions? What are you doing right now to keep not only your staff safe, but volunteers, blood donors that are coming?
Yeah, first and foremost, before anyone enters the blood donation area, whether you are a donor, perhaps, an employee like me who's going out to a blood drive, a member of the media, even anyone who's entering that blood donation area has to have their temperature taken before they even enter the area. If it is 99.6 or above, 99.6 or above, that unfortunately you won't be able to enter the area. So that is our first line of defense. There is hand sanitizer before entering the drive. All stations throughout, the entire area of the drive. We are social distancing our beds. Typically we'll set up maybe in a square or sort of a semicircle of lines of beds, but we're making sure that even those areas, those beds are 6 feet apart. So that donors aren't necessarily next to someone. We are following our CDC guidelines, making sure that anyone who enters the donation area, whether it be staff, whether it be donors, everyone must wear a face covering. Of course, our staff are wearing gloves. They change them often. They are routinely wiping down and sanitizing any donor touch surfaces and staff touch surfaces to make sure that that is part of the process as well. You're also taking a second temperature check during the health history process, which is something that we always do. But again, that's that second line of defense when it comes to a possible fever. So there are many, many, many different protocols in place that have been enacted to ensure that donors feel safe when they come out to help save lives.
And so a minute ago, you said that about when the surge happened, 80% of the donations decreased because that was, you're going in, churches are closed and malls are closed, right? Where is the bulk of the donations coming from now? I know some of that's reopenings, but where are the bulk of your donations coming from?
So our bulk of our donations are coming from wonderful, generous community sponsors who are getting back to hosting their drives. A lot of people have regular drives on the books. They might host 4 times a year. So they've gone ahead and shifted to the summer to make sure that those drives stay on the books. We're seeing new sponsors come forward, which is fantastic, opening up their gymnasiums, their large auditoriums where we do have that ability to space out. That has been fantastic. We've had partnerships with Anheuser-Busch, who have worked together with our national sports teams, our NFL teams, some MLB teams, to open up stadiums to be able to go ahead and host there as well. Again, those large spaces. And we are seeing a tremendous response from people who have come out to our brick and mortar blood donation centers as well. There is one in Connecticut and Farmington, and just seeing that overwhelming support. We did see that surge really at the end of April, heading into, the end of April. We saw just an outpouring of support. We saw a very, very severe shortage. To be able to use those words, we don't use those lightly. So when the outbreak really took hold here, the end of March into the early April, we saw that severe shortage. Again, tens of thousands of dollars, tens of thousands of donors that weren't able to come out or postpone their donation. When we put the call out, letting people know there was a severe shortage, letting people know that the need for blood doesn't stop, it's constant, we saw thousands upon thousands of donors come out and meet those immediate needs. It was a tremendous outpouring of support. To be able to turn around from a severe shortage to say we met those immediate needs in, really just a matter of a couple of weeks was just truly amazing and heartwarming and inspiring. And I think it's something that people felt, they were able to do something, had control of something that they could help during this uncertain time. So we did see that, and I go on pretty long, I'm sorry here.
No, that's fine.
See that, but now, as this uncertain time continues, we don't know. There's no end date here, right? We don't know exactly when this is going to end. We're starting to see that trail off again. We're seeing in the last couple of weeks or so, a 30% sharp increase in demand from hospitals. Because as things start to reopen, hospital demand is up. Those procedures that were put on hold, maybe those elective surgeries, they're starting up again. Those treatments that perhaps were put on hold again, were put on hold during the really critical time. We're starting to see that increase in demand again. So that means that we do need these donors to come forward again. And at this time, we're in an urgent need status.
Okay, so I'm hearing there's a lot of volatility, right? You were in the red, no pun intended here, but you were needing a need for blood. Then you had a lot of people step up, start to meet it. Now again, the surge is coming. In the whole, where are we? Are you behind where you usually are at this time as far as blood? Or are you? Just trying to kind of figure out where you are on the scale.
Yeah. So, we are watching every day, no matter that, whether it's because of coronavirus or just because it's summer, we're heading into summer. We typically do see this time of urgent need heading into the summer months. Typically we are in a place where we start to see that decline. Donors, during the summer months when school is out of session, we host a lot of, like I said, school hosted blood drives. When schools are out of session, when people are on vacation, summer activities, we always see that decline during the summer. So, there's not a lot of vacations happening right now. People are staying put, but again, it is typical to see this type of situation crop up June, July, and August, where we do enter a situation where we are, seeing that urgent need. We want to prevent another shortage from happening. We see the numbers going down. So the last thing we want is another shortage to overcome. So right now, that's why we are putting out the all call to donors who are eligible to please consider helping to save lives.
Okay. And so are you collecting plasma right now for COVID? Is that something the Red Cross is doing?
We're working with the FDA. We're one of other blood collector organizations across the country who are collecting that convalescent plasma from recovered patients. It is a tremendous duty to be able to provide that to hospitals. We've been doing that for several weeks now. We have collected thousands now, convalescent plasma units to be administered to COVID patients. And we are continuing that process. That is something that doesn't stop as well right now. Of course, we want to continue to be able to provide that. The best way, if there are interested people who are looking for ways to give back now that they are recovered, we ask that you go to redcrossblood.org/plasma, the number 4, COVID. And that is a form that you will fill out, giving you, questions to help kind of navigate the process to see if you are eligible to donate. If you are eligible to donate, then one of our representatives will give you a call back and either schedule an appointment for one of our Red Cross centers or for another blood bank if you are not near one of our centers. We're just doing our part to all work together in this situation to make sure that those COVID patients have access to the plasma that they need.
And so has that model changed as far as you getting the plasma for the COVID patients, or is it the same model you've always been doing for plasma, or has anything changed since COVID?
So typically plasma would be a donation or a platelet donation as well. I can talk about that afterwards, but whether you're donating blood, plasma, platelets, typically you are able to go onto our website, our app, and look for available appointments within your area. A platelet or a plasma donation, you do have to do at one of our blood donation centers. Because of COVID, this is a completely uncharted territory. We want to make sure that we're helping to filter the particular potential donors that have those antibodies that will be able to help those coronavirus patients. So what we're doing is that has changed. That's why you're going on to that specific website to fill out the form. Our special team is analyzing all of those tens of thousands of forms that have been filled out online and submitted to make sure that we are identifying patients who are eligible to give. And from that, looking at, the location of the potential donor, setting up the best option, the best brick and mortar location, or if it has to do with another blood bank that's nearby, a competing blood center, which again, we're all working on this together. So yes, that has changed when it comes to convalescent plasma. The regular plasma process is still the same, but this is specifically for recovered COVID patients looking to help other patients.
Got it. Thank you. All right, so I'm about to ask you now 2 naive questions. All right, so I've stacked them up together, but if they're on my mind, possibly they're on somebody else's mind who didn't take the time to research it. Sorry. Can COVID be transferred through blood?
At this point, there is no known transmission through blood products at all, and that is something that we've stressed, through the entire process at the outset of the outbreak. So no.
Okay, so it doesn't seem like it can be transferred, and so there's no testing protocol for the blood if it has COVID, because from all that we know from research, it can't be transferred.
So it's not there's no known evidence of transferring of blood products. However, you can test for antibodies, for example, after the plasma donation. We are, vetting, the donors that have the eligibility requirements to go ahead and donate specifically convalescent plasma. But then after the fact, they are going through testing. Those convalescent plasma donations specifically are going through testing to once again evaluate the amount of antibodies in there to make sure that we are sending those products where they need to go and making sure that people have the amount of antibodies that they need to help convalescent plasma patients, COVID patients.
Got it. I understand now. All right. So now my second naive question, that wasn't too bad. Here's the second one. And it's even more of a broad question, but it's very relevant to this crisis here. I mean, you said it even before that you're in a crisis, right? And you say severe crisis, and you don't throw that term out loosely. So I know that it's serious right now as far as lack of donations. Walk me through what happened. I always hear blood shortage if there's a blood shortage, but what does that actually mean? So somebody gets, God forbid, in an accident, shows up in the ambulance, and there's a blood shortage. What does that mean? Blood has to get transferred from another hospital. I mean, I'm just trying to figure out when we have a shortage, how does that really affect people?
Sure, sure. Just to be clear right now, we're trying to prevent a shortage. So I
Yes.
don't want anyone being
No,
too
that's good.
alarmed.
You're
We
right.
did
Yeah.
see that severe shortage. We're trying to prevent another one. So, it does vary from time to time as demand varies from hospitals. But sometimes that means that products are going out to hospitals faster than they're coming in from donors. So we work on a national inventory level. So the Red Cross, we supply 40% of the nation's blood supply, and that means that we work on this nationwide level where we have the ability and the unique responsibility to send blood wherever it's needed the most. So we are able to move across the country where things are needed. In fact, a lot of people have said to me, I got this great alert on my app saying, I donated in Massachusetts, but my blood went to somebody in Utah. While we do prioritize those local responsibilities, if there are situations like this where there is a need somewhere else and there might be a shortage at that local level, we are able to move it across the country due to our nationwide inventory. We always like to keep a 5-day supply of our blood products on hand as well to make sure that we are prepared for emergencies on a higher scale. Perhaps there is some sort of natural disaster or unfortunately a man-made disaster, so we want to ensure that we have that 5-day supply to be able to provide to our partners throughout the country and make sure that they have that on hand. So when we come down to a shortage, again, we have inventory, but it is dropping and it's going out to hospitals faster than it's coming in.
Good. Okay. No, that makes sense. And thank you for clarifying that. Right now,
Yeah.
it's not a shortage. But that actually will lead into my next question. It's always hope for the best, plan for the worst. I hope this is not the case, but if there's a second surge, we have to in the fall go back to what we did before, isolation and not being able. What has changed for you? Do you have has the Red Cross been talking about more long-term plans moving forward, maybe even after this, even after we get a vaccine? What's going to change for the Red Cross? How are you preparing for it if this happens again?
That's a great question. I think that we are constantly monitoring every hour of the day to see how this is evolving and shaping up. And, what I can tell you is that our leadership, our field crews, we are just constantly looking at, how our safety measures are playing out. Are they adequate? Are we following CDC guidelines? We're going to continue to follow the CDC guidelines no matter what it takes. So we are obviously always looking ahead. That is why we're looking ahead to prevent another shortage. And, obviously making sure that we alert donors, help them understand that it is a safe process. Again, things are starting to open back up in many places around the country, but if we do fall back into a unfortunate situation where there are lockdowns, just reminding the public that this is an essential service. Blood cannot be stockpiled. So we will have those opportunities available and continue to engage our potential hosts as well to make sure that we have the spaces available to be able to handle any donor surge that we need to accommodate. So.
Okay, so I'm going to play a little bit of the other side here. Maybe it's what is on some people's minds. Allie, everything you're telling me, it sounds great that you're preparing. I can tell you're doing your diligence, and I know it sounds safe, but look, I'm just still a little nervous. I'm a blood donor, but I'm still just a little nervous. I don't want to go back now. I don't know if there's any way it can help. How would you address that?
Well, we want people to do what they feel is best. Certainly, we're not going to push people who are very uncomfortable to come out. Certainly, you follow, how you feel. But in the second part of your point there, I don't know how I can help. One, if you do decide to donate, you're helping many different types of patients. So I would explain trauma patients, as you mentioned earlier, in the ER. A lot of times that requires blood products very quickly. Cancer patients as well. Oftentimes they use blood products for their treatments. Burn victims, new moms, with complications, heart surgery patients, organ transplant recipients. There are many, many different reasons that patients need blood. Sickle cell patients as well. So, if there's a little help in explaining who that blood goes to, if you do decide to come out, believe me, there are plenty of different patients who need access to that blood on a constant basis. But certainly, we wouldn't, it's really, we want people to experience their comfort level, understand. We also have other ways that you can support. whether it be financially, through redcross.org, you can learn more about that, or through a Sleeves Up campaign. If you're not comfortable coming out, or you're not eligible at the time, that you could start what we call a Sleeves Up campaign, and that's really a virtual blood drive with your friends. Start a campaign online, visit redcrossblood.org/sleevesup. And you can go ahead and kind of set up your network of friends and families who are ready to go out and donate, who might just need that little bit of information to help them understand how to make that appointment. And they can go wherever they want across the US where we have opportunity, and they can go and make it part of that campaign. And it's a really neat way for people near and far to come together, especially during these times.
And so that's great advice too. And that's kind of what I was getting at. Right? The donations are one aspect, but I know there are other ways in this time of crisis. What say keeps you up at night? Because hopefully it doesn't get to that level. But what do you worry about at the Red Cross? I mean, again, there's a lot of uncertainty. What kinds of things are kind of keeping you up that you're concerned about moving forward?
It's just, it's a matter of saving lives. Plain and simple. That is our mission, is to ensure that people have access, because if they don't have access, this is a very, very serious situation. These are patients, these are moms, dads, kids, and we need to ensure every single day that they have access to that blood product that they need. So I'll say it again, it cannot be stockpiled. Blood has a shelf life of 42 days. Platelets have a shelf life of 5 days. So all of this must constantly be replenished. Volunteer donors are the only source of blood in the US. So it cannot be, man-made as well either. So that's what, 42 days, it can't be stockpiled. And that's really what we have to think about on a daily basis to make sure that we have the ability to have real donors, real volunteers, real staff to make a difference. And that's what we try to do and spread the word through generous outlets like you.
Last question for you, and it's really, I'm just turning the table over to you, or turning the ball over to you. Anything that I didn't ask that you think is important for somebody to know, anything you just want to expand on? I just want to give you the last few minutes here.
Yeah, I think a lot of people have a myth about the actual donation process, and that, it takes a full hour on the table, that sort of thing. So a lot of times we get a lot of questions about, what is really, how do you take me through it? So what we try to do is really encourage, especially during this time, to encourage people to make appointments ahead of time. Because of this uncertain time, we're trying our very best to make sure that we can adhere to social distancing at blood drives. So you can understand that if people are walking in, that might create a bit more of a crowd than expected. So we are really stressing that people make appointments ahead of time. There are many ways to make it. redcrossblood.org, I've said a few times, 1-800-RED-CROSS. You can download our free blood donor app and make it through there. And then also, if you have an Alexa, you can download the blood donation skill through any Alexa Echo device. So any of those 4 ways, you can go ahead and make an appointment. And then once you get there, people will go through first, a temperature check, and then be asked to review a series of questions to make sure that they hit that initial eligibility. They'll go through a health history check. It's private. You'll get your iron levels tested. You'll have a blood pressure check, a little mini physical. You'll have your temperature taken again. And once that's completed, you'll head over to your donation bed. So the actual donation process really only takes about 8 to 10 minutes, and that's it. Our trained staff is ready to greet you, make sure that it is a positive experience for you. And then after that, you get snacks. So everyone says that's our favorite part, is the snacks. So we ask people to kind of carve out 1 hour of time for the donation experience, but just keep in mind that actual donation process only takes about 8 to 10 minutes.
Well, I appreciate you taking the time to go through all this today. I know it's important work that you're doing, and like you said, the summer is when demand's still going up, so it's still a need. Yeah. Even if it feels like things have been easing back because of COVID, there's still a need, and we don't know what the future's going to hold. So it is something that needs to be in front of mind. So I do appreciate you taking this time, Alan.
And I appreciate the opportunity to spread the word. So thanks, Adam, very much.
All right, thank you.